Thank you very much, everyone, for coming here today. This is really a wonderful, wonderful crowd, and I'm so, so happy. I'm Claudine Jurkovitz, and I'll talk about the program a little later. I'd like first to introduce Dr. Jackson, who is the Director of Health Care Delivery Science in the Value Institute, as well as the Associate Director of the Value Institute, and he will give some remarks. Thank you so much.
All right. Well, good morning. That's actually pretty good. But let's try it one more time. Let's get some. I'm going to use a term from my college fraternity. Let's put some enthusiasm in it, some what we call some E. So let's try again. Good morning.
Good morning.
There we go. Now I feel good. It's like being in church. And welcome. Welcome to Christiana Care. As you can see on the slide there, we serve our neighbors as respectful, expert, caring partners in their health. We do this by creating innovative, effective, affordable systems of care that our neighbors value. Notice the word choices: neighbors, partners, respectful, innovative, together, working together as to solve these problems. And that's actually what this event today is all about. We are partnering with all stakeholders. We are including patients in this discussion so that we can better understand how to deliver the best services that our patients and neighbors deserve. We would like to congratulate Dr. Claudine Jurkovitz on hosting this very important event. I think it's worth giving her a round of applause. And I would also like to take a special moment to recognize Mrs. Lakia Moore, which I'm looking around and I don't see her, but she has really, really worked really hard putting this together, and she would probably hate me for mentioning her name right now, but because she's that kind of a person. But she has, I think we should give her a round of applause as well for this. As mentioned in the Christiana Care Way, we want to promote a strong emphasis on engaging patients in the broader healthcare community. We want to encourage patients and other stakeholders to become integral partners or members of this discovery process. This event seeks to provide a platform to expand the role of all stakeholders. It seeks to create a vibrant linkage between providers and patients so that we may together develop sustainable solutions for today's vexing healthcare conundrums. Christiana Care is committed to exceptional patient experience and optimal health. We recognize that only 10% of outcomes for patients are actually determined by the hospital environment itself. There's a concept known as social determinants of health: where you live, your education level. If you're not reading by the third grade, on grade level, it has negative impacts on your health outcomes. If you live in a food desert, this also has a negative impact. The number of liquor stores per square mile, that's a government-sanctioned activity, has an impact on health outcomes. So all of this together has an impact, as well as genetics and other things. All of this together actually influences outcomes, and we want to explore that with you. We have chosen to use kidney disease as an indicator condition to allow us to identify best practice for service delivery. How should we structure a registry to deliver the information that we need? How do we get the signal-to-noise ratios appropriate so that we can drive performance and preference amongst providers and patients? So a lot of the discussions that are going to happen today are going to be multi-level discussions. We recognize that this is not an issue of just giving someone a medication. It's a full package of services operating on many different levels that have to be coordinated in order to address this problem as we transition from childhood to adulthood. So we'll be exploring all of that. In closing, I'd like to welcome and congratulate everyone, and we really want your ideas. This is, to use the Silicon Valley approach, this is really a user group type of focus group experience. We are making no assumptions. And so we're listening and we're learning together. Thank you. I would like to introduce Dr. William Weintraub. Dr. Weintraub is one of our most distinguished clinicians at Christiana Care. He is a leader in the field of cardiology. He has played a significant role in the foundation of the work the discovery work we do at Christiana Care. He has played a significant role in the CTR, Center for Translational Research grant, and he played a major role in the CMS Innovation Grant. All laid the foundation for the work that we're going to talk about today. Dr. Weintraub, welcome.
Thank you, Dr. Jackson. Well, you know, Eric, you're always a hard act to follow today as well. And I think your opening remarks were just perfect for setting up this day. I'd also like to thank several people. First of all, a tremendous amount of credit goes to Claudine for putting this all together, and I'm going to discuss that in a bit. Also, I'd like to thank Lakia, who worked so hard to make this happen. We have also a very special guest here today who I want to recognize. Carolyn Jenkins has come all the way from Medical University of South Carolina. At least wave, Carolyn, so everyone knows who you are. She's one of the real leaders in the whole country in community engagement and has taught us a tremendous amount about how to do this. Now, how did this all come about? Claudine has had this vision of a statewide CKD database to try and understand chronic kidney disease, and she stuck to and developed this vision for years, and has developed a series of grants from the American Heart Association and from the National Institutes of Health. And then we got this CTR grant. So what is this? So this is a large grant from the National Institutes of Health plus the state and our partnering institutions, which are ourselves here at Christiana, the University of Delaware, AI DuPont Nemours Hospital for Children, and the Medical University of South Carolina. Total funding in this grant is very large. It's $28 million. It's one of the largest grants that we collectively have ever had, and it's really been transformative. And it's really also highly in alignment with our other activities here, especially the Value Institute. Eric, I would hasten to say that they're almost on top of each other in alignment. One drives the other forward in a very good way. And through this, we also have a series of large grants, and one of our largest is called a Big Data Grant. And Claudine has actually gotten 2 of these to develop the CKD database for the entire state that links also pediatrics and adult care. So this is really extraordinary. But how do you use this? What are you going to do with this once you have it? And this is what's so satisfying and so very important about today, because Claudine got yet another grant. She got one of the first Corey grants in the state and the first Eugene Washington stakeholder engagement grant in the state of Delaware. And what's really terribly exciting and terribly important is that this links all this hard work developing this big database about all of these patients with understanding why it's important and what we're going to do with it. And that's what today is all about, why it's so very exciting. And let me end with one more thanks. Thanks to all of you for coming today. I think we're going to really work hard, and we're going to really accomplish extraordinary things. Thanks again for coming. And now let me turn the podium over to our leader for today, Dr. Claudine Jurkovitz.